lateral epicondylaris, tennis elbow problems. It might be for overuse and repetition type injuries as well. You can do the same thing on the flexors depending on what the problem is, and certainly thinking about your lymphatic drainage and other supportive taping techniques for your de Quervain veins, for carpal tunnel and those types of pathologies as well. So I'm going to do a little bit of a combination. If it was a common extensor origin tendinopathy, I would use my compression strip directly over that tendon. So I won't do that today, but that's what I'd be doing, as well as my extensor strip. Okay. So I'm going to come down. I'm going to go down into the thumb. Go this way, if that's okay. Jump around, guys, so you can see. Sorry, I'm going to have my back to you otherwise. Now I'll show you this one in terms of one way where we can cut the tape as well. So what I'll get you to do, Claudia, is pop your wrist into some flexion. So we've got the extensors on some stretch, again using that recoil thinking. And what I'm going to do is just roughly estimate how far down the wrist you're going to go. I want it to go to the base of the wrist and the thumb so that we can actually do a strip around your thumb as well. So I'm actually going to cut the tape down the centre. Like that. So you could do this for your knees and shoulders as well, have one anchor point and then cut it and go around, especially if it's a 10 centimetre piece. I still do cut or tear the backing of those. I just find it a lot easier to work with so that you're set to go. Okay, so we're going down the extensors, same application. I'm going to come down. I'm going to head towards the thumb now. Okay, so you can take that part off. Now we're going to go up into this position. We can go, there's a few different ways. We can go all the way down the thumb, long down this way, and I just cut off how long I need. Some of you have already tried that as well. You can pop it into a little bit of flexion if you're able to. So I might just have that part. And I'm going to round my edges just so it sticks. It's really nice for thumb injuries too, if you're putting it on the side for collateral injuries, mainly because it moves so well nicely around fingers and you can actually rough fingers with it. Get rid of that strip. Okay, then we can actually use this strip as a supportive strip around the thumb. So I'll just make sure we don't have any stretches there. Around the thumb. And then finishing the anchor back over here. Okay, so we've now started to use it a little bit like a stretch tape to give that CMC joint some stretch and support as well. Okay, so we've got a few things here. I've combined a few techniques. You might be doing this just for your thumb, or we might actually be doing just the forearm part for your tendinopathies as well. Okay, you can also do it down fingers, wrist positions for retraining type things as well.
So for tennis elbow, you just stop about there somewhere?
Yeah, I'd usually stop at the base of the wrist, and I'd probably head more over this area, right over the common extensor origin, and then my compression strap is directly on that area, so we get that lifting effect. So we've unloaded the extensors so that they don't have to work quite as hard, and we've also lifted over the tendon area to allow healing and
Would we just split down there or just leave it?
If it was purely just for that, I wouldn't even bother going down into the wrist and thumb. I'd just do it up here in that area there. Yeah, so this might be a really good one more for your de Quervain type injuries. Yeah. Okay, so there's a few additional ones. Now the other thing too, a few people touched on this when we were going around in groups about assisting biomechanics. So I definitely use kinesiology tape and the dynamic tape a lot for, I guess you'd call it performance enhancement. So especially with my overhead athletes for serving or throwing, I actually do spirals in kinetic chains as well with using the elastic recoil to actually assist their throw. So that could be to help unload tendon areas so they're not having to work as hard, or it could actually be working on technique. It depends what you're trying to achieve, and obviously it's dependent on that person and what their sport is too. So you can do spirals and feedback around the knee for hyperextension injuries. You can really play around with kinetic chain as well, and thinking about fascial slings in both directions as well. Okay, so I'm just opening your mind up to think about lots of different things. So have a play with these last ones. I know I've gone through 3 there, so you're a bit overloaded, but make sure you have a go of the shoulder in particular. That's a really useful one for your overhead athletes, and your general shoulder pain patients. And then if you've got some time, have a go of these other ones as well. Okay. So as I mentioned, if you are wanting to head off earlier, please make sure you just fill out a feedback form and take your certificate. And